the last 10% of our nerves is pain related, 90% is not. So there's so much more happening with this person, with their health, than just their pain.
Welcome to AMC. I'm Dr. Greg Miller. Are you overloading your patients with knowledge during the exam? Today, Dr. Jeremy Brubaker is going to explain how doctors make this common mistake. You won't want to miss his discussion on the underlying goal of the exam. If you find this video to be useful, please click the like and subscribe buttons. Let's get started.
Hello, today we're talking about exam. And what we want to focus on today, and we all do exams, right? Part of the new patient onboarding process, we got to get our clinical histories, we've got to get an evaluation, and everybody's exam is going to be a bit different. But the underlying principles of what we cover, why we cover them, are all going to be pretty much universal. But today I want to focus on a couple key points that we teach that I think will be benefit for you no matter where you're at. And one of the most common things we see in an exam is, instead of being what we consider an I during the exam, where we are evaluating, we tend to be the mouth, where we're explaining, we're almost giving a report during the exam process. And that's one of the biggest mistakes that I see is, instead of just taking the information in, assimilating it, thoroughly analyzing all the different diagnostics, the consultation, and putting all the pieces of this patient's clinical case together, instead we start to give our reports way before we have all the information gathered, which sometimes, and a lot of times, leaves the patient kind of not knowing, not understanding, not really tracking. It makes sense to us, but the way we're communicating that necessarily isn't as smooth and concise as it can be. And ultimately, it affects their decision-making process when they decide, to get the proper care that they need. So that's point one. And again, join us as one of our training events, and we'll dive deep headlong into that. But take that point today into your exam. Second thing when I think about exam is, what is the underlying goal of an exam? And I think there's three. Number one, to get a great evaluation, right? Understand the patient's problem, what they're doing clinically, diagnostically, get all those pieces. Yes, that's the exam. But also, what seeds can we plant during that exam process to help the patient become educated, understand the scope of what they're dealing with, that it's most oftentimes more than just a pain problem. Agreed? And a lot of us run pain practices, and ideally we want to run health practice, wellness practice, maintenance type practices. Where does all that start? It starts by the way we approach every procedure in our office, begin with the end in mind, but it also, some very pivotal points in this particular exam. For instance, there is a point in your exam and in my exam where it's okay and very proper to go, what concerns me more than your symptom, your condition, what you brought to the office, is what we're finding, what we're discovering during this exam process, and more importantly, how it relates to your nervous system, to your health. If you don't have that as part of your exam process, at least starting to introduce the concept of this is bigger than pain, because we all know, right? The last 10% of our nerves is pain related, 90% is not. So there's so much more happening with this person, with their health, than just their pain. We never discount their pain and symptom because that's what got them there. So we take that seriously, but there's also a point where we start them on the journey going from pain, symptom-minded to more of a health-minded, optimal wellness, quality of life mindset. Doesn't necessarily happen overnight, but there's a part during our exam that is a great place to start the process. So those 2 points, be the I during the exam, not so much the report mouth, and also start the transition for the patient from pain to health. Hope this is beneficial. Take and use it. Have a great day.
Doc, AMC is your guide to becoming respected, effective, and valued in practice. We know what works, and we prove it with our Grow Guarantee. If we can't help your practice grow, it costs you nothing. Text us at 904-966-4996 for more details. See you next week.